Doctors of Reddit. What patient made you go, "How the fuck are you even alive?" We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s, he was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile, he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife, and that dude lived. Remembering that story got me through a lot of tough years in the because I think it just reminded me that hope and good outcomes are still out there. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation. Diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg per deciliter. Normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64-ounces sodas and candy bars into the hospital. Literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of, how the fuck did you survive that trauma, disease? But, how the fuck do you even function on your own? I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. I was on home call for in a small town. Got a call from the nurse one night and she was like, "M's brought someone in here and they think she might be dead." I was like, "Well, is she?" She was like, "I don't know." This was a seasoned RN, by the way, so I was like, "Well, guess we're treating this as a code blue kind of situation." So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay, lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1, for those familiar with lab values. The backstory was extreme self-neglect, depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my ICU rotation and I see this guy awake and conscious. Pretty crazy. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open-heart CABG surgery. He needed 12 units of blood, his heart massaged then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 a.m., he opens his eyes. I was shocked. He has a permanent track and ostomy now, but somehow is alive. My dad is 87, he had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. Patient here. When I was 2, I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan. This was 1990. And when they were done, they turned me back over and I was blue, had stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages. Everything but major organs. I made a full recovery. I am a healthy 31-year-old now. Zero asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 50 to 90%. Of those who live, approximately 20 to 30% regain any brain functioning. Due to the subdural hematoma, the bleeding in my skull was so severe that I also had cranial herniation. My brain tilted 5 millimeters, causing my brainstem to compress into my spinal cord. That I not only lived, but woke up, and recovered well enough to go back to work, get married, travel the world, return to baseline physically is a straight-up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day, and he says the same thing. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her cycle during internship, man with police officers behind him came in the The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. A guy, now passed away, who had incurable lung cancer from Agent Orange exposure during infantry service in Vietnam, and his wife had recently died. Cancer. Wife died. Guy was pretty positive, glass half full about chemo considering the double whammy. Asked him how he managed to keep it on the positive. He said he was returning to base with just days left on his enlistment. Rookie pilot has a mechanical failure of some sort in their Huey. They are going down, and not the controlled kind of landing either. He assumes he is about to die. Says everything got real slow, real bright, and a sense of acceptance and peace washed over him. Rookie pulls one out at the last moment, lands their bird with no casualties. Patient told me he felt he should have died that day, and every single day since was a complete gift. Maybe being alive has a lot to do with attitude. Obligatory, not a doctor, but my dad is, and he liked to tell us about the crazy shit he saw. This post made me think of one of those in particular. Huge guy, linebacker build, came into the trauma ward with a gunshot wound dead center of the chest. He could breathe fine and he had a pulse. So they did a chest x-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. I have a hospice patient that has been on our service for 4 years. I am either really great at hospice, or really bad at it. My father's doctor couldn't believe he didn't need to amputate his feet, and he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart and clogged arteries. One day, his feet went black. Not just bluish or gray. Black as charcoal. Rushed to emergency. We were told they would amputate, but to say our goodbyes. Dad refused surgery. Said he'd rather be dead, at his age. Hours later, his feet were pink. We took him home that morning. Doctor actually apologized for upsetting us, but said he'd never seen anything like it. Veterinarian. Dog hit by a train. It severed the dog's leg and the dog carried its own leg home. Owner brought dog and leg to the ER. I'm a psychologist, not an MD or DO, but I work at a psychiatric hospital. Anyway, one of my patients a few weeks ago was a 15-year-old boy who was regularly neglected as an infant by his mother, who was an addict. When he was around 5 years old, his mom pimped him out to men for sex in return for drugs. When he was 9, his stepfather gave him a skull fracture after beating him with a wrench. When he was 14, the same man shot him with a pistol for talking back. He's in foster care at the moment, and suffers from CPTSD and depression. But he's the sweetest boy I ever met. I wish him the absolute best in life going forward. He deserves it. Patient here. When I was 7, I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night, and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the fuck I was still alive. Now 16 and haven't had any hospital-worthy complications since. And god damn it, my mom is the most amazing and loving person on this green earth.